I'm Julie Taylor from the Physical Education Department, and I've been teaching first aid CPR for the American Red Cross since I moved to Cedar City, and that was about 9 years ago. Since then, the curriculum has gone through several iterations. CPR has been a constant, and one of the things that they actually have always taught, just hasn't been emphasized, is what we're going to focus on today, and that's a modified CPR technique, which is just a hands-only CPR technique. So I'm going to show you the traditional CPR technique, which includes rescue breaths, but in some situations you may not be able to give effective rescue breaths, or you may choose not to give rescue breaths, and that's not actually the most important part of the CPR skill. The most important part of the CPR skill is the chest compressions, which help to circulate oxygenated blood to maintain delivery of oxygen to the organs and to the brain until an AED arrives or until paramedics arrive and take over. So we're talking about what we're going to do in a cardiac emergency. So if somebody has a heart attack is an occlusion of blood flow in one of the coronary arteries that supplies oxygen to the heart. When that happens, that part of the heart will fail to function efficiently, and you could go into cardiac arrest. Your heart may stop beating, and that's when blood flow to the rest of the body stops. So the CPR technique is what we use to help compress the heart and circulate oxygenated blood. Simple steps. If somebody's having a heart attack and goes into cardiac arrest, we're going to follow the emergency action steps, and that includes check, call, care. The 3 C's. We're going to check the scene to make sure it's safe. We're going to check our victim. We'll tap and shout, hey, are you okay? If there's no response, call 911. Most importantly, you want to call 911 as quickly as possible to get EMTs on the way with their medications and technology and everything that's going to improve the chance for that person's survival. So call 911. And then we're going to care for the conditions that we find. We're going to check their airway, breathing, circulation, and in this case, we're going to administer CPR, assuming that it is a heart attack. Okay, so I'm going to show you a short video that demonstrates for you the traditional CPR technique, which includes 30 chest compressions followed by 2 rescue breaths. And then we're going to practice a modified hands-only technique, which simply is chest compressions. Now, like Renee said, she's been calling it new, but it really has been around longer than I've been teaching first aid CPR. It just hasn't been emphasized until the last year or so. So it's easy to learn, it's easy to do, and it could save a life. So we're going to go to the video, and then we'll do a short demonstration and give as many of you as possible a chance to actually practice this skill on our Area 51 alien dummies over here.
Knowing how to correctly perform CPR will help you provide care to a person having a cardiac emergency until another trained responder or EMS personnel take over. First, you will learn how to give effective CPR compression. Then we'll add giving rescue breaths. Finally, we will practice some cycles of CPR. This video is designed so you can practice the skill while you watch it. However, your instructor may ask you to practice the skill after watching the video. If so, watch closely. You'll practice soon. Now get ready to practice CPR. Position yourself next to the mannequin with your gloves on and your CPR breathing barrier ready. First, place the heel of one hand in the center of the chest along the breastbone. Then, place the other hand on top and lace your fingers together. Position your shoulders directly over your hands. Keep your arms as straight as possible and your fingers up and off the chest. Push hard and fast in the middle of the chest, at least 2 inches deep. Now, give 30 chest compressions. Try to keep an even pace. The compression should be at a rate of at least 100 per minute. Counting out loud can help you. Ready? Go. Each compression should be smooth. Let the chest rise completely before pressing down again. Don't take your hands off the chest, just your weight. Okay? Stop. Give another full set of 30 compressions. Remember, keep an even pace. The recommended rate is at least 100 compressions per minute. Ready? Go.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29.
Okay, stop. CPR is performed in cycles of 30 chest compressions and 2 rescue breaths. To give rescue breaths, use a CPR breathing barrier if available. Tilt the head back and lift the chin up. Then pinch the nose shut and make a complete seal over the mouth. Blow in for about 1 second. Watch for the chest to rise and fall with each breath. If the chest does not rise, re-tilt the head and try another rescue breath.
Okay, we're not going to practice the rescue breaths, but we are going to practice the chest compressions. So that's traditional CPR. If you have a breathing barrier, if you have the proper safety equipment, the rescue breaths do add a little bit more oxygen to the bloodstream. But at rest, we have more than enough oxygen in our bloodstream to supply what's needed for our organs and for our brain. So the most important component of the CPR skill is really the chest compressions. So doing effective chest compressions is most important. Rescue breaths, great if you can do them, but chest compressions, most important. Okay? So I'm going to demonstrate for you real quickly with our aliens the skill that you're going to show me today. So we're going to go through check, call, care. You're going to check the scene, make sure it's safe. Check your victim. Hey, are you okay? There's no response. Call 911, he's unconscious. Then we're going to check for signs of life. Then we're going to check. Then we're going to check for signs of life. We're going to kneel down next to our alien. We are going to tilt the head back to open the airway. We're going to get right down over their mouth and nose and look, listen, and feel for signs of life for no more than 10 seconds. 1, 1,000, 2, 1,000, 3, 1,000, 4, 1,000, 5, 1,000, 6, 1,000, 7, 1,000, 8, 1,000, 9, 1,000, 10, 1,000. If there are no signs of life, going straight to chest compressions. So heel of the hand, center of the chest. You're going to interlock the fingers, keep them up off the chest, arms straight, shoulders directly over your hands. Use your upper body weight, and we're going to compress to at least 2 inches. 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and 11. And we will continue that with hands-only CPR indefinitely. Hopefully until an AED, an automated external defibrillator, becomes available, or until EMTs arrive and take over. So we don't stop CPR until an AED becomes available, until the scene becomes unsafe, until we see obvious signs of life, which is very unlikely once we start CPR, until someone can take over for us. So an AED, just for your information, looks something like this. We have one of these in the PE building. There's also one here in the Charwan Smith Center. You want to get these on site as quickly as possible. Cardiopulmonary resuscitation, CPR, is very unlikely to revive a victim of cardiac arrest, but an AED may. For every minute that CPR and a use of an AED is delayed, you reduce their chance of survival by about 10%. So the quicker we can start CPR and get an AED on site and use it, we can dramatically improve their chance of survival. So AED, these are very user-friendly. To use an AED, you open it up, you find the on button,
apply pads to patient's bare chest.
and follow directions.
Plug in pads connector next to flashing light.
All you got to do. Turn it on, follow directions. Pads, everything you need are in the
Apply
case.
pad.
And he gets
Plug in
impatient if you don't do
connector.
it quick enough. And reminds you what you need to do. Okay? So AEDs, very user-friendly. They're intended to be that way so that people won't be intimidated to use them. So CPR and an AED.
Julie, is there some standard place where they keep these AEDs, or do you just have to know where it is?
They put a sign in the hallway. So in the Sharon Smith Center, the AED is located in the public safety office just down the hallway. And over in the PE building, it's in the cage, in the equipment cage. It's it's right down the hallway. So on your way out today, actually look for the AED sign on the wall. So it's kind of centralized in the building. You guys have seen it?
It's right in the rotunda, right here, kind of by Marshall's office next to you.
Yeah, right here. I've seen it. I don't know what office it is. It's in the hallway. But that's where they keep the AED. Those are the two that I know of.
One downstairs in the tunnel by the locker rooms in the center.
In the tunnel by the locker rooms?
Julie, we have one over in the housing office.
And housing has one. Yeah, they're becoming more common, which is great. And high schools are starting to get more of them because that's something that can really save a life for a young athlete that goes into cardiac arrest. They've shown that across the nation. Other questions? Yes?
I don't know how pertinent this is, but when we call 911, what kind of questions do you think they're going to try and ask and get out of us in all of this?
What's the nature of the emergency? He's unconscious. Where are you? So give them really good directions, and if you have somebody that can go outside the building and meet them and show them where you are, that can save some time. They might ask about the age of the victim, if you know their medical history, that kind of thing. So just being able to describe the condition and your location in detail is going to help them get there as quickly as possible. Yes?
Would this be the same for children or is this adults?
For children, it's very similar. For infants, less than a year of age, rather than doing two-handed chest compressions, typically with those smaller bodies, you can do sufficient chest compressions with 2 or 3 fingers in the center of the chest. Yes?
By center of the chest, do you mean kind of where the rib cage comes apart, or what? Where exactly?
Center of the breastbone, right on the sternum. Other questions? Yeah. Not with hands only. With hands only, you keep going. Don't stop. Yeah, so they count 1 and 2 and 3 and 4. You could do row, row, row your boat gently down the stream as long as you keep the pace, whatever works for you. 9, 7, 6, 3, 2. You just want to keep that pace. So they typically count out loud when they're doing the cycles, 30 compressions, 2 breaths. When you're doing hands only, as long as you keep the pace, whatever music or counting or anything that's going to help you keep going. And hopefully you have someone that can take turns with you, because we'll do some cycles of 30 to practice, and you'll see that that'll catch up with you pretty quick. So we're hoping you're not by yourself, but you do it as long as you can.
How long between cycles?
If we're doing hands only, there's no break. Yep. Keep on going as long as you can. Or until an AED gets there, or someone takes over for you, or obvious signs of life. Any other questions? All right, who's ready to practice? So you got this one, 2, number 3, 4, and 5.
Make a fool of myself.
Okay, let me have you stand just a couple steps away from your alien to start with. So I'll go over here. All right, you have just entered a room. Ideally, if we had gloves, we would put them on. Okay? But you can choose to do CPR without gloves, and the risk of disease transmission is very low. You've just entered a room. You see what appears to be an unconscious adult lying on the floor. The very first thing you're going to do is check the scene. The scene is safe. Check your victim. Tap and shout. There is no response. Call 911.
He's unconscious.
Okay, we're going to check for signs of life. So you can put 2 fingers on the chin, 1 hand on the forehead, head tilt, chin lift. Pull that chin up. You're going to face the chest, look, listen, and feel with your ear and your cheek right over the mouth and nose for no more than 10 seconds. We'll assume we're on 5, 1,000, 6, 1,000, 7, 1,000. 9, 1,000, 10, 1,000. There are no signs of life. You'll now position your hands in the center of the chest. Heel of your hand right over the sternum. The other hand right on top of it. Interlock your fingers. You want to put your shoulders directly over your hands. Keep your arms straight. And we're going to do 30 chest compressions in this case. Ready? 3, 2, 1, go. 1 and 2 and 3 and 4 and 5 and 6, 7, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 20, 21, 22, 23, 24, 26, 27, 28, 29, 30. If we were doing hands-only CPR, you would not stop at this point. You would keep on going. How'd that feel? It is work. Now, if you keep your arms straight and use your upper body, you won't get as tired. Let's do another set of 30.
If you see somebody that's not positioned right, correct them because
absolutely.
They're saying to, she's kind of high, she's kind of low.
Mm-hmm. On my count, 3, 2, 1, go. 1 and 2 and count out loud on your own. Arms straight, shoulders right over your hands. Really think about keeping those arms straight. You want to compress to at least 2 inches. So really use your upper body weight. Compress to at least 2 inches. So that's a lot. Yeah.
Do their ribs still crack?
Potentially, especially with elderly people that maybe have osteoporosis. Absolutely. Okay.
So if you crack them?
Keep going. They're going to die. They're going to have a broken rib. I'd go with the broken rib. Yeah. All right. Let's try 5 new rescuers. Okay, so couple steps back from your alien. One more on this side. All right. You've just entered a room. You see what appears to be an unconscious alien lying on the floor. First thing you're going to do, check the scene. Scene is safe. Check your victim. There is no response.
Call 911.
Yes. Call 911. He's unconscious. We're going to check for signs of life. 2 fingers on the chin. 1 hand on the forehead. Head tilt, chin lift. Pull the chin up. Face the chest. Face the chest. Face the chest. Look, listen, and feel for no more than 10 seconds. There are no signs of life. Position your hands in the center of the chest. Heel of the hand right over the chest, right over the sternum. Interlock your fingers, arms straight, shoulders directly over your hands. And 3, 2, 1, go. 1 and 2 and 3 and on your own count. Let's do 30. At least 2-inch compressions. So slow them down just a hair and try and go deeper. Use your upper body weight. Good. All right, so you would keep going if we were doing hands-only CPR at this point. Ready for one more set of 30? Okay, so think about keeping your fingers off the chest, putting all your weight on the heel of your hand. So, heel of the hand, center of the chest. Arms straight, shoulders over hands. 3, 2, 1, go. 1 and 2 and 3 and 4. Shoulders just up a little bit so you can really use your upper body weight. Yes, you want them directly over your hands. There you go. All right. Any questions? If it's hands only, we're just going to keep going. Yeah. If we were also doing rescue breaths, regardless of the age, it would be 30 compressions followed by 2 rescue breaths. For hands only, don't stop. Doesn't matter. All right. Looks good. We got 5 more? So even though we're practicing 30, you would not stop with hands-only CPR. You just keep on going. All right, you've just entered a room. You see what appears to be an unconscious adult lying on the floor. Very first thing you're going to do, check the scene. Scene is safe. Check your victim. Tap and shout. No response. Call 911. He's unconscious. There we go. You're going to open the airway now. 2 fingers on the chin, 1 hand on the forehead, head tilt, chin lift. Look, listen, and feel for signs of life for no more than 10 seconds. Face the chest. Face the chest. 5, 1,000, 6, 1,000, 7, 1,000, 8, 1,000, 9, 1,000, 10, 1,000. There are no signs of life. Position your hands to start CPR. Heel of your hands, center of the chest. Interlock the fingers. Arms straight, shoulders directly over your hands. And 3, 2, 1, go. 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and on your count. At least 2-inch compressions. Use your upper body weight. Heel the hands, center of the chest, right there. Use your upper body weight. Good. Shoulders right over hands. Good. Okay, if we were doing hands-only CPR, you would continue. You would not stop at 30. Sit back, relax. We'll start a new practice session. So at least 2-inch compressions for adults, at least 2 inches. Really focus on keeping those arms straight and using your upper body weight. You're not going to take your hands off the chest, just take your weight off the chest. On my count, 3. Oh, place your hands first. Get your hands set. And 3, 2, 1, go. 1 and 2 and 3 and on your count. Row, row, row your boat gently down the stream. Whatever keeps you on pace. At least 2 inches. Use your upper body weight. Really get some 2-inch compressions there. Good workout? Any questions? All right, you got the basics. Anybody else? All right, y'all have just entered the room. You see what appears to be an unconscious adult lying on the floor. First thing you're going to do, check the scene. Second thing, check your victim. Tap and shout. There is no response.
Call 911.
Call 911. He's unconscious. Checking for signs of life now. 2 fingers on the chin, 1 hand on the forehead. Head tilt, chin lift. Look, listen, and feel for signs of life for no more than 10 seconds. There are no signs of life. We're immediately going to position our hands in the center of the chest. Heel of the hands, center of the chest. Interlock the fingers. Arms straight. Shoulders directly over your hands. And 3, 2, 1, go. 1 and 2 and 3 and 4 and on your count. Let's do 30. Arms straight. Bring your shoulders right up over your hands. Right up over your hands. Yeah, use your upper body weight and get that heel of the hand right in the center of the chest. Good. When you get to 30, sit back. So again, think about getting all your weight on the heel of your hand and keeping your fingers kind of up off the chest. So you're really focusing in the center of the breastbone. Arms straight, shoulders over hands. 3, 2, 1, go. 1 and 2 and 3 and 4 and 5. 2-inch compressions. Go for those 2-inch compressions. At least 2 inches. Bring your shoulders up again. Any questions? Thank you for coming. Thank you for your participation.